What if your doctor had the information to predict and treat a heart issue early so you can spend your summer on the beach instead of in a hospital bed? Or help you prevent diabetes so you could stop worrying about glucose levels and focus on family time? We're using machine learning to make that possible. Our award-winning predictive models enable our nurse care managers to identify and reach out to high-risk members sooner. That's the future of healthcare, and the future is already here in North Carolina.
When I think about machine learning, sometimes people hear that phrase and they get a little anxious, especially as it relates to healthcare. Healthcare is, and at least in my mind, will always have to have a personal touch. The way I view machine learning is that it enables those individuals who provide that personal touch. One of the ways I feel it can be beneficial is when patients, say, are missing a doctor's appointment or they are missing refilling their medications. That's something that a machine learning algorithm can identify. They can send that notification to a nurse, and then a nurse can outreach to the patient and understand why have they not been able to follow up with a physician. It's very, very difficult for people, whether it's a family member, whether it's a nurse at a health plan, to keep track of every single patient like that on a daily basis. But by using machine learning and gathering that kind of data, even if it's weeks or months after the hospital admission, the algorithms can identify something's amiss here. The patient might actually be feeling fine, but the machine algorithm can predict that, a week later or a couple days later, that person is going to be in the emergency room with difficulty breathing from heart failure.
We've designed our in-house models with a proactive and protective mindset. Looking for more than diagnosis of chronic illness, our technology can help identify members who likely have difficulty accessing the basic resources needed for good health, like nutritious food, all while keeping privacy top of mind.
We look at these models and we scrutinize from a clinical lens to make sure that, one, that we're protecting the member, do no harm, and then two, we're looking at, is it truly relevant to a clinical practice? Like, how will this benefit the member or patient? When we're looking at health equity, we always have to address the bias. So there are a lot of touch points to make sure that we're effective, we're protecting the members, as well as that there are positive outcomes.
Our technology has been recognized across the healthcare industry for its ability to help improve patient experiences, prevent serious illness, coordinate care between providers, reduce hospital visits, and lower the cost of care. From reaching out to at-risk members early, to assisting with complex case management, to helping patients move from hospital to home. This data-driven approach gives Blue Cross NC new, innovative ways to make it easier for members to navigate their needs and take control of their health.